Concerns are mounting over the future of South Africa's HIV and TB response as non-profit organization Inyathelo warns that reduction in international funding could disrupt critical healthcare services. Now, programs supported by key global partners are facing increasing pressure, raising questions about sustainability and access to treatment. Hi, a very good evening. My name is Thabo Molokwane. Welcome to this edition of Soweto Today. Now on the show tonight, we unpack the growing concerns around HIV and TB programs in the country as funding challenges put frontline services under pressure. Joining us virtually to help us with this conversation is Feryal Domingo, the Acting Executive Director of Inyathelo. Mr. Domingo, much appreciated for taking the time. Good evening. Welcome to the show.
Thank you very much, Thabo, and thanks for the invitation. It's really a pleasure for us to be here.
Much appreciated for gracing us with your presence. I mean, maybe let's start the conversation by maybe outlining the concerns raised by Inyathelo regarding the sustainability of South Africa's healthcare sector.
Thabo, so I think we've all heard about the recent state of affairs in the Northern Hemisphere and in the West. And so what we're finding as Inyathelo is that we really do think that our healthcare system is standing on what we call a funding cliff. So there's a sudden withdrawal, or it's actually taken maybe it started last year. So we are incredibly concerned. We really are concerned that in fact the backbone of our community health, a lot of this is managed and held with the support of the non-profit sector. That is being dismantled by the sudden withdrawal of support. It is a really big concern for us. And so after 24 years of us working within NPOs at Inyathelo, we are seeing a level of fragility. We're seeing that tenderness, that vulnerability that we've never seen before. It's just crazy.
Let's talk about the funding constraints. Maybe just get into it from international partners. As you said, USAID, PEPFAR, also affecting HIV and TB programs. How are we faring in those programs at this point since those announcements?
Look, I want to raise a hard fact. The issue is that these aren't just budget cuts. We're looking here at what I would call a shockwave. So since 2025, we've seen at least 8,000 healthcare jobs lost. That's a phenomenal number of jobs lost in the non-profit sector. So because PEPFAR and USAID were the engines behind some of our HIV, AIDS and TB care programs in South Africa, we're feeling the knock. We're feeling this as a tremendous knock. So when the money freezes, we know that the progress of 2 decades of work actually is put at risk overnight. Right? Mm-hmm. And so that's what we are experiencing right now. The impact is phenomenal. And that the fact that the South African government hasn't come to the party in a big way yet, and I'm hopeful, that is a concern as well.
I'm glad that you're mentioning, the challenges currently that we can see as a result of the funding gaps. Let's talk about what specific service gaps, are beginning to emerge as a result of these funding pressures. We know the community health workers have been the backbone of the healthcare system, and various people that are on the ground assisting in preventative campaigns and all these things. Are we starting to see these gaps showing?
Look, I'll give you an example. I chatted to an organization that serves hospices, right? And she said to me that because of this crisis, they are no longer able to go into family homes. They are no longer able to go right there where the need is. They're not able to provide that touchy-feely service that they're known for. I mean, when somebody is at the end of life stage, you want to be there. You want to be there for that individual. You want to be there for the family. And so they say what they're finding now is that's limiting. That's become so limiting to them because of this level of the lack of funding rather, and the losses and the lack of funding has led to job losses. And if you don't have the people to be able to do all this work, then clearly there is an impact. So we are seeing there's in some parts of the country, there's clinics that is closing, there are mobile services that's no longer operating at the level that they used to operate. And specific, as I mentioned, this linkage to care, this fact that we want to be there as a hospice, we want to be able to serve, that's the mission of the hospice. And if they're not able to do that because of this, then I think it impacts on the health system in a very, very big way. Testing rates are dropping and the counseling services that our communities need, that's the support that they need. Patients need us through a diagnosis or, all of that is being cut because they are not able to provide the extras that is needed. And it's not just extras. We see those as essentials.
We're in conversation with Feryal Domingo, the Acting Executive Director of Inyathelo, as we unpack more on the funding cuts there. We look at the growing pressures after the outbreak of, non-profit and frontline healthcare workers, especially focusing on the mental health aspect. We take a quick short ad break. When we come back, we'll continue with more. Do stay with us.